Good morning, everyone. I will have loved to join you in person today. I'm glad you're meeting to celebrate and reflect on the Salud Mesoamérica initiative because it's been an outstanding success. As you know, Salud Mesoamérica is a public-private partnership aimed at improving access to quality health for 1.8 million women and children in Central America. The partnerships that made Salud Mesoamérica possible, the IDB, the Gates Foundation, the Carlos Slim Foundation, Canada, Spain, and these 8 countries has changed the landscape of public health in Central America. So how do we know it's been so successful? First, we collected a lot of data. We also hired top-tier specialists from NORC at the University of Chicago to evaluate the results. What did they find? They found that we improved not only the access to healthcare, but the quality of healthcare delivered to some of the most vulnerable women and children in Central America. That includes not just improving maternal and neonatal care, but doing it at twice the typical pace of improvements in low and middle income countries. Let me give you 3 examples. In the poorest cantones of Costa Rica, we helped reduce teen pregnancies by over 11% compared to the richest cantones. And across the region, the share of newborns receiving quality care rose by almost 5 times. Emergency neonatal care also improved 14 percentage points. That's the number of babies receiving critical care, like oxygen, antibiotics, and other life-saving treatments. Our motto is improving lives. And Salud Mesoamérica hasn't just improved lives, it saved them. So, what's the takeaway from all this? 1, we have been successful because we have focused relentlessly on results. We got the results we wanted because we measured everything. Before Salud Mesoamérica, we were really flying in the dark. In many areas, like quality of care, we didn't have reliable data. But we know that if you measure it, you can improve it. So, from day 1, we surveyed households and health facilities, and we established baselines to build on. Second, we provided technical assistance, know-how and expertise to help countries take effective action to produce tangible results. Third, we use a unique results-based financing model that tied financial incentives to measurable health outcomes. This increased accountability, innovation, and accelerate results. Looking ahead, as you reflected on the success of this great initiative, I encourage you to think about how we can keep making progress. Challenges remain, and we want to overcome them. Let's also think about how we can expand and scale up this model in other regions and for other challenges. So let me thank you all for your leadership that made this possible. You went beyond improving lives. You saved them and forever made a difference in the lives of many others. Thank you very much.
Buen día a todos. Con mucho gusto me dirijo a ustedes para reflexionar sobre los aprendizajes y logros de la Iniciativa Salud Mesoamérica. Un esfuerzo que ha transformado vidas y marcado un precedente en nuestra región. Durante 15 años, esta iniciativa ha demostrado que trabajar juntos con compromiso e innovación puede generar cambios reales. Hemos fortalecido los sistemas de salud, reducido brechas y mejorado la calidad de vida de millones de mujeres y niños en 8 países, incluso ante desafíos como la reciente pandemia. Hoy celebramos avances importantes en la atención materna, neonatal e infantil, gracias al trabajo incansable de los equipos de los Ministerios de Salud y al liderazgo del Banco Interamericano de Desarrollo, quienes han sido piezas clave en este esfuerzo. El desarrollo de incentivos positivos y la medición de resultados han sido fundamentales para garantizar que este modelo no solo alcance sus metas, sino que sea sostenible y replicable. De hecho, Salud Mesoamérica ha inspirado otras iniciativas exitosas, como la Iniciativa para la Eliminación de la Malaria. Detrás de cada logro hay historias de vidas transformadas, familias más saludables y comunidades más fuertes. En la Fundación Carlos Slim creemos que la inversión social debe generar un cambio profundo y permanente, y eso es lo que buscamos en cada esfuerzo, incluyendo esta iniciativa. Finalmente, quiero agradecer una vez más al Banco Interamericano de Desarrollo y a todos los donantes, en especial a la Fundación Bill y Melinda Gates, por su apoyo constante. Este trabajo en conjunto nos muestra que un futuro más saludable es posible si mantenemos la misma convicción y la misma determinación. Muchas gracias.
Good morning, distinguished guests, colleagues, and partners. I regret that I can't join you in person today, but I want to extend my deep appreciation to the Inter-American Development Bank for bringing us together and for its leadership in strengthening health systems across Mesoamerica. I also want to acknowledge our partners, governments, health experts, and donor organizations, including the Carlos Slim Foundation, who have championed innovation and collaboration in primary healthcare. The Salud Mesoamerica initiative was built on a simple but powerful idea that measurable, equity-driven investments can transform health systems, and they have. When this initiative began 10 years ago, Indigenous women were 3 times more likely to experience life-threatening complications or death during pregnancy and childbirth. And children whose mothers had limited access to formal education were 3 times more likely to die before their first birthday. Through this project across Mesoamerica, national health indicators have improved, yet persistent inequities remain, especially for women and children in historically under-resourced communities. These challenges are not unique to this region. Many countries navigating economic and social transitions struggle to ensure that progress reaches those who have been systematically excluded. Mesoamerica reminds us that development gains are fragile unless they are intentional, equity-focused, and sustained. And the Salud Mesoamerica initiative has demonstrated a different path forward. By aligning donors and governments around measurable targets and shared incentives, SMI has helped drive meaningful impact, expanding access to preventive care in El Salvador, reducing adolescent pregnancy rates in Costa Rica, and strengthening local health systems. More than that, SMI has been a learning lab, rethinking how aid is delivered, how local leadership is strengthened, and how data is leveraged for accountability. These lessons must extend beyond Mesoamerica and hold relevance worldwide. While SMI itself has concluded, its work and its impact must continue. The real credit goes to the health workers, community leaders, policymakers, and program managers who are sustaining these gains and pushing them further. And at the Gates Foundation, we remain committed to ensuring that the lessons from this initiative inform and strengthen our work around the world. Aligning incentives, leveraging data, and strengthening local leadership are essential strategies for building resilient, inclusive health systems everywhere. If we build on this momentum together, we can drive sustainable, equitable change. Thank you.